You may think the most dangerous sleep mistake after 60 is choosing the wrong side of the bed. It is not. The bigger danger is going to sleep every night with loud snoring, repeated awakenings, morning headaches, or unexplained daytime exhaustion, and assuming those signs are simply part of getting older. Your sleeping position can influence your airway, reflux, and comfort, and in some people the severity of obstructive sleep apnea, but no sleeping position guarantees you will prevent a stroke. No responsible health professional should tell you that turning onto one particular side will magically clean your brain, protect your arteries, or erase decades of cardiovascular risk. Today, we separate useful sleep position advice from dangerous internet myths. In the next few minutes you will learn 6 nighttime mistakes adults over 60 should stop ignoring, 2 positions that may improve breathing and comfort for the right person, and the warning signs that mean you should stop watching and seek urgent medical help. Why sleep deserves more attention after 60. Sleep is not a period when your heart and brain simply switch off. Your breathing, blood pressure, heart rhythm, oxygen level, and nervous system continue working throughout the night. As we get older, sleep often becomes lighter and more fragmented. Conditions such as high blood pressure, atrial fibrillation, heart failure, reflux, arthritis, and sleep apnea also become more common. Poor sleep is not automatically inevitable after 60. A new sleep problem deserves investigation instead of dismissal. There is evidence that strokes occur more often during morning hours, but that does not prove that a pillow, a twisted neck, or sleeping on the wrong side caused the stroke. Controlling established risks, especially high blood pressure, smoking, diabetes, abnormal heart rhythms, and untreated sleep apnea, matters far more than chasing a miracle sleeping position. Mistake number 1. Ignoring snoring, gasping, and breathing pauses. Loud snoring is not automatically sleep apnea. But snoring combined with choking, gasping, witnessed pauses, frequent awakenings, dry mouth, morning headaches, or excessive daytime sleepiness should not be ignored. Obstructive sleep apnea happens when the upper airway repeatedly narrows or closes during sleep. Each event can interrupt breathing and force brief awakenings that you may not remember, preventing continuous restorative sleep. Sleep apnea is associated with high blood pressure, irregular heart rhythms, cardiovascular disease, and stroke. Ask your partner, do I stop breathing, gasp, or choke during the night? If yes, changing your pillow is not enough. Discuss symptoms with a healthcare professional. A sleep study, at home or in a sleep center, is the appropriate way to determine whether sleep apnea is present and how severe it is. Mistake number 2. Assuming back sleeping is healthy for everyone. Back sleeping can be comfortable and reduce pressure on painful shoulders or hips, but for many people with obstructive sleep apnea, breathing events become more frequent or severe on the back. Gravity can narrow the upper airway in susceptible people. If your partner says your snoring becomes dramatically louder on your back and improves on your side, your position may be affecting your airway. That observation is useful to share with a clinician. Side sleeping may help positional sleep apnea, but it may not be sufficient for moderate or severe disease. CPAP, an oral appliance or other medically supervised treatment may still be necessary. If you already use CPAP, do not stop using it because a video told you to sleep on your side. Position can support treatment. It should not replace effective therapy without professional guidance. Mistake number 3. Believing the left side is a miracle and the right side is dangerous. The heart sits slightly to the left, but that does not mean everyone must sleep on their left to protect it. There is no strong evidence that sleeping on the right side causes stroke or damages the heart for most adults. Research into brain waste clearance and position is interesting but not ready to support dramatic promises about preventing dementia or stroke. Individual medical conditions matter more. Left side sleeping may reduce nighttime reflux in some people. Some people with heart failure report more discomfort on the left and prefer the right. Arthritis, recent surgery, lung disease, shoulder pain, and hip pain also influence which side is tolerable. The correct position is the one that allows you to breathe comfortably, sleep with fewer awakenings, protect painful joints, and follow your clinician's advice. If lying on either side causes chest pressure, severe shortness of breath, or a new racing or irregular heartbeat, stop experimenting and seek medical evaluation. Mistake number 4. Forcing your neck into an extreme angle. 1 thin pillow is not automatically healthy, and 3 pillows are not automatically dangerous. What matters is alignment and comfort. A pillow that is too high can push the chin toward the chest. A pillow that is too low can allow the head to fall backward or sideways. Either extreme may contribute to neck pain, stiffness, muscle tension headaches, tingling, or repeated awakenings. Aim for neutral alignment. When side sleeping, the pillow should fill the space between the mattress and your head so the neck remains roughly neutral. When back sleeping, use enough support to keep the neck comfortable without forcing the chin sharply toward the chest. If you need elevation for reflux, snoring, or breathing difficulty, elevate the upper torso gradually with a wedge or adjustable bed rather than stacking pillows under the head. A major warning sign, needing to sleep upright in a chair because you cannot breathe while lying flat. That can indicate significant heart or lung conditions and should be discussed promptly with a clinician. Mistake number 5. Using alcohol or sedating products as a sleep solution. Alcohol can make you feel sleepy, but sedation is not the same as restorative sleep. As alcohol is processed, sleep becomes lighter and more fragmented. It may worsen snoring and nighttime breathing in susceptible people, increase nighttime bathroom trips, and raise the risk of falling when you get out of bed. For adults over 60, the body often processes alcohol and medications differently. The same caution applies to sleeping pills, antihistamines, anti-anxiety medicines, opioid pain medicines, and combinations of sedating products. Never stop a prescribed medicine abruptly. Do not assume an over-the-counter sleep aid is harmless because it is sold without a prescription. Ask your pharmacist or clinician to review everything you take, including nighttime cold medicine, pain medicine, herbal products, sleep aids, and alcohol. The dangerous part is often the combination. Official guidance recommends avoiding alcohol close to bedtime because it produces lighter, more interrupted sleep and may impair nighttime breathing. Also watch heavy meals close to bedtime. Fatty, spicy, or acidic meals can worsen reflux and trigger awakenings. A gentle walk after dinner can help establish a calmer evening routine if it is safe for your mobility. Mistake number 6. Trusting a gadget more than your symptoms. Smartwatches, rings, and fingertip pulse oximeters can show useful trends, but they can also produce misleading readings. Cold hands, poor circulation, movement, nail polish, device quality, skin characteristics, and incorrect placement can affect accuracy. A single number should not be used to diagnose sleep apnea or declare your heart and lungs healthy. The claim that every oxygen reading below 92% automatically confirms a dangerous sleep disorder is too crude. Some people may require urgent assessment at that level, while others with chronic respiratory disease may have different targets set by their medical team. Context matters. Use home devices as conversation starters, not final verdicts. If a device repeatedly shows unusual readings, record the time, your position, and any symptoms, then show that information to a healthcare professional. And do not let a normal-looking gadget reassure you when you have serious symptoms. Sudden chest pain, severe breathlessness, fainting, blue or gray lips, new confusion, or stroke warning signs require urgent help, even when a watch says everything is normal. 2 sleeping positions worth trying. Position 1. Comfortable side sleeping. Side sleeping is often a reasonable first experiment for people who snore or whose obstructive sleep apnea worsens on the back. Choose the side that feels most comfortable unless your clinician has given specific instructions. Place a pillow under your head that keeps the neck neutral. A pillow between the knees may reduce twisting through the hips and lower back. If you tend to roll onto your back, a body pillow in front of you may help maintain the side position. Do not force the position through severe shoulder or hip pain. Pain fragments sleep, and fragmented sleep defeats the purpose of the change. You can place a pillow behind your back for support, alternate sides, or ask a physical therapist for a setup adapted to your joints. Give the adjustment several nights rather than judging it after 10 uncomfortable minutes. If breathing, pain, dizziness, or palpitations become worse, stop and seek advice. Side sleeping may help many people with positional obstructive sleep apnea, but it is not a guaranteed treatment for everyone. Position 2. Back sleeping with gentle upper body elevation. If side sleeping is not tolerable, back sleeping with the head and upper torso gently elevated may help some people with reflux, snoring, or positional sleep apnea. The important detail is gradual torso elevation, not sharply bending the neck with a pile of pillows. A wedge or adjustable bed creates a smoother incline. Small studies suggest head-of-bed elevation may reduce sleep apnea severity in selected patients, but it does not replace a sleep study, CPAP, or another prescribed therapy. A small pillow under the knees may reduce lower back strain for some people. Make sure the arrangement is stable and does not increase your risk of sliding or falling when getting out of bed. Anyone with heart failure, severe lung disease, recent surgery, spinal problems, or major mobility limitations should discuss significant position changes with a healthcare professional. The nighttime routine that matters more than a perfect side. Position is only one variable. Aim for a consistent sleep and wake time. Keep the room dark, quiet, and comfortably cool. Reduce bright screens before bed. Limit late alcohol. Keep the route to the bathroom clear and remove loose rugs that could cause a fall. If pain wakes you repeatedly, address the pain. If urination wakes you 5 times a night, discuss it. If your legs feel uncontrollably restless, mention it. If you sleep 7 to 9 hours but still doze off during conversations, television, or driving, that should not automatically be dismissed as just age. Keep a simple 7-day sleep record. What time you went to bed, how often you woke up, whether anyone noticed snoring or breathing pauses, what position you were sleeping in, whether you woke with a headache or dry mouth, how sleepy you were during the day, and whether alcohol, a heavy meal, or a medication affected your night. That record is more useful to a clinician than saying, "I do not sleep well." The stroke warning signs you must never sleep on. Remember BEFAST. B. Sudden loss of balance. E. Sudden vision loss, double vision, or major visual change. F. Facial droop. A. Arm weakness. S. Slurred speech. T. Time. Call emergency services immediately if you see these signs. Sudden severe headache unlike anything before. Sudden confusion, sudden numbness or weakness on one side, sudden trouble walking, and sudden difficulty speaking or understanding also require urgent help. Closing. Sleep complaints after 60 are not automatically inevitable. Persistent snoring, gasping, repeated awakenings, morning headaches, daytime sleepiness, or needing to sleep upright deserve medical attention. Use position changes thoughtfully. Side sleeping or gentle head of bed elevation may help for some people, but they do not replace diagnosis and treatment when needed. If you notice worrying symptoms, or if someone tells you they see you stop breathing at night, talk to your clinician about a sleep evaluation. This video is for education only and does not replace professional medical advice. Before you go, tell me in the comments, do you usually sleep on your back, your side, or your stomach?